Good afternoon. My name is Bing Chang. I'm the chair of the board of directors of the Arthritis Foundation, for those of you who don't know me. I'm a rheumatologist in Chicago at Northwestern University, and I'm very privileged to be chairing the board of directors. I happen to also do research in arthritis, and so I'm very much involved and interested in our breakthrough program, the scientific discovery program that the Arthritis Foundation has really created over the last 1 or 2 years, and hopefully we'll really get rolling next year. So I think those of you who are here at lunch will find this to also be very coherent with the patient voice story, as we're trying to incorporate patient voices into the scientific discovery activities of the Arthritis Foundation. And hopefully by the end of today, you'll understand how that is going to happen. Okay, so we're going to focus on, in our scientific strategy, which includes our 4 major initiatives, and you can see them there. Advancing the treatment for osteoarthritis, conquering juvenile arthritis, addressing the rheumatology shortage, and creating a learning system that allows patients and healthcare providers to collaborate to improve health outcomes. With our focus on advancing science and treatment for arthritis, along with our Major Gifts campaign, we are truly stepping toward a cure, and I'm excited really to be part of this. Today's session will include addresses by 2 of our senior staff, Eakin and Suz Schrandt, and we also have a guest, Bruce Marshall, who's an executive from the Cystic Fibrosis Foundation, who will speak to us about the importance of co-production and patient engagement, okay? Without further ado, I'm gonna hand it over to Guy. Guy is the Senior Vice President for Scientific Discovery, and he'll give us a dive into our current work and how it's impacting our organization and people with arthritis. Guy.
Right. Well, thank you, Bing. So let me find the slide up. So we have, get the first slide up. All right, so you all saw this slide last year, and I love this slide because it really shows what we feel about the Arthritis Foundation. You know, this is an organization that's been behind some of the pillars of discovery in arthritis over the years. So we have 2 FDA-approved drugs up on the map here. We have even the first clinical trials that brought methotrexate to rheumatoid arthritis, and this is a mainstay of treatment to this day. You know, and so what we feel from this, what we can see is that this is an organization that has a very broad and very deep, very rich history. And so what we began to talk about last year is, you know, what's that path forward? What are we doing in 2017? And one of the hidden stories on this timeline is that as amazing as these discoveries are, that the path to getting from that initial discovery to clinical reality is often 15 to 20 years. And so this, you know, what we're working on, and we will continue working in these areas, but what really excites me about this organization right now is that we're asking that question of how can we take our research agenda and turn it into something that can get into, that can become something that you can feel, that can become health outcomes that you can realize on very near terms. So let's take a look at that. So one of the things that I'm most excited about this year is that advancing osteoarthritis treatment. And this is, you know, this is an idea that last year it was just an idea, and this year it's really starting to mature. And so let's take a moment and remember what got us to this place. You know, we live in a desert of osteoarthritis therapeutics right now, and that, you know, that right now the drug development community is really waiting for a signal from the Food and Drug Administration that says that the Food and Drug Administration is going to change its opinions about how clinical trials are conducted. Right now, clinical trials in OA generally require seeing changes on an X-ray, and we know that those X-ray changes take a very long time to develop. And so what we feel here is that this community, this group the Arthritis Foundation and the patient community have a leadership role in working with the FDA and working with our drug development partners to really, to really show that these clinical trials can be run cheaper, better, faster. And that what we believe is that the projects that we're initiating on right now will show a way for the osteoarthritis drug development community to really lift off and take new interest in osteoarthritis if we can show them the data that says that these goals, these surrogate endpoints, these biomarkers that we're talking about are scientifically valid and logistically feasible for the purposes of running clinical trials. And you're going to hear from Suz Schrandt in a little while about how the patient voice has been brought into working with the FDA to really channel and really codify how the FDA thinks about clinical trials from the perspective of a patient. And so, focusing back on the research side of the organizations, for several years, we've been making some really dramatic decisions in osteoarthritis about what it is that we're funding, and that set us on this platform for really being able to launch a set of projects moving into, starting this year and moving into the future that really, have two spectacular ideas associated with them. One is we're building this clinical trial network, and what that means is that that when the day comes that the FDA does send that signal that I talked about, that we're ready. That we have a group of centers around the nation that have all raised their hand and say that we know how to take state-of-the-art clinical trials and now deploy them in a way that is the same between all of these sites, and that if we do that, we're going to get the interest of the drug development community. We're going to get more meds into the pipeline, more shots on goal, a faster route to regulatory approval, and a faster route to getting these medications into our clinicians' hands and into patients. But the other idea here is that we're not just waiting for this. We're actively shaping that landscape. And what I mean by that is, as we look at these projects that have initiated this year, this is about showing that these biomarkers work. This is about showing that these sites have reproducible data. It's about taking and repurposing drugs that have been known for years to the RA and JA community and asking the question of, as transformative as these drugs have been in those communities, can we now realize that same transformation in the osteoarthritis space? So that to me is incredibly exciting, and what we're showing right now is that we've created this proving ground for new medications in osteoarthritis, and that this network is working. And so I moved through that somewhat fast, and if you didn't catch all that, you're in luck, because one of these amazing little videos we have comes up on my next slide. And so they really do a nice job of capturing what it is that we're trying to do. So do you mind rolling the tape?
Today, more than 30 million Americans of all ages suffer from osteoarthritis. That number is soaring as sports and military injuries increase and our population gets older. Currently, there are no cures or drugs to halt OA's progression. Existing remedies only treat the symptoms, and expensive surgery is often the only option. Meanwhile, millions live in constant pain day after day. But they can wait no longer. As the established leader in the arthritis community, we're the only one who can tackle this problem. The biggest obstacle keeping the healthcare industry from taking this on is the high risk involved. Due to the time it takes for OA to develop and be diagnosed, and the time it takes to prove the effectiveness of treatments. But the Arthritis Foundation has the muscle and the know-how to move that boulder out of the way, unblocking the path to progress and breaking through to real treatment options. Using our collaborative force of leading experts and doctors, we'll create an OA Center of Excellence at top medical facilities and a clinical research network. And by leveraging our strength in advocacy, we'll help change policies that will speed up the process. With your financial support, we will open a new era for OA therapeutic development and accelerate the pace of scientific discovery. Together, we'll change the landscape and clear the path to bring new therapies to market like no one else can. A real change to the future of arthritis is coming, but we can't do it alone. Will you be part of it?
So the other big idea, and what really excites me about working with the Arthritis Foundation and the volunteer community, is that we are really at the leading edge of organizations that are building that antenna that allows us to be really attendant to the needs of the community that are here in this room and all the patients that are not with us in this room today, and to be able to develop those programs that really serve those needs. So if we turn the page to talking about that idea of co-production, one of the things that's fascinating to me about co-production is it is so simple. This is the simple idea that when a patient and a doctor arrive in a room, that the skills and the knowledge, the experience that they both bring together can be put together to develop the best possible healthcare plan for that patient, respecting that patient's own goals, and be medically appropriate for that patient. And so, as easy as that is to describe, that conversation leading to that point is not always as easy. And so where do we begin with that? And so we are certainly inspired by things that are happening overseas and also in our domestic communities, but we're asking those questions of, like, by bringing these ideas of co-production together, we should be able to realize a state in the future where flaring is reduced, where we don't need as many clinical visits. And what we're really doing is bring the power of research methods, bringing the evidence forward that tells us what are those best practices that allow patients to be empowered to manage their own care in those times between those doctor's visits. And so we do know that this is possible. We know that there's been some fantastic successes. We're going to hear from Bruce Marshall at the Cystic Fibrosis Foundation in a moment, also is being explored in IBD communities. And so what we're asking right now is, what does this look like in our hands? And so one of the things I want to ask you to remember is that this isn't necessarily new. The Arthritis Foundation has been working in ideas of co-production for years. When you think about the toolkits that we offer, so for instance, the Your Exercise Solution, the Yes Toolkit, or even the information that might come through Arthritis Today, really what we're doing right now is just kicking this up a notch and asking whether or not we can do a better job of facilitating that conversation. So we can't do it without partners. And so these are the partners that are working on one aspect of this project with us. And so they're really right now doing the heavy lifting with us of designing a suite of technology-driven tools that give patients in the rheumatology community really an unprecedented view of the data that's being collected about them in the registries, in the electronic health records, and then giving those rheumatologists an equally important view of what those patients' goals are and what those self-reported outcomes are going to be for that patient in preparation as they come into the office visit. And so those things, that conversation is what really constitutes how arthritis feels to the patient and how that drives the life that the patient lives within a chronic disease. And all these are ideas that you saw in some of the earlier videos that we showed. So this is no small feat. We're asking all these registries to work together with clinical partners to build interoperable systems. We are working together to prioritize the health outcomes that we expect to be able to measure and track. And all of this is just absolutely thrilling to see that we are really emerging with what is fundamentally a different way it's a new era of healthcare for rheumatology, and we are doing this. So I don't want to focus on the technology that we're building. It is exciting, but it's also important to remember that it's not just about technology. This is about actually supporting a culture of research and a culture of clinical care. And remember, when we say research, often we think about test tubes and beakers, but this is all about using those research methods to ask the question of how is it that we best help our community build the skills and the confidence that allow them to go back and facilitate that question, that conversation around co-production. And so the goal in all of that is to help patients better navigate their own health care and lead healthier lives. So I'm gonna wrap up, and I'm gonna wrap up simply by saying is that, you know, the thrill of what's going on at the Arthritis Foundation for me is really that idea that we're just in very near terms taking our research dollars and translating them to health, and that we're working, you know, in a space where patient engagement truly matters and is driving our research agenda, and that this is truly, you know, truly a revolution, and it's not possible without any of you. And so thank you very much, and I'll turn it back over to Bing.
Thank you very much, Guy. So as you've just heard, we are committed to and understand the value of including the patient voice in all the work we do, especially when patient and healthcare provider communication can lead to better health outcomes. So now I'd like to introduce Bruce Marshall, the Senior Vice President for Clinical Affairs at the Cystic Fibrosis Foundation. He's going to talk to us about the importance of co-production and patient engagement. While different than arthritis, cystic fibrosis is a rare disease that, like arthritis, doesn't have a cure and requires special treatments and drugs to support a better quality of life for patients. Bruce has been with the Cystic Fibrosis Foundation since 2002 and has effectively helped the organization be a leader and game changer in quality improvement, clinical practice guidelines, patient registry and educational resources, among other areas where he's helped improve patient engagement and outcomes. So now, please help me welcome Dr. Bruce Marshall to the stage.
Thanks, Bing. I didn't want to interrupt him. You want a few more minutes to go on? It's an honor to be here with you today. And I know it's late afternoon, you've had a busy day, so hang in there with us. Guy asked me to focus on the patient engagement work at the CF Foundation, so I'm going to give you sort of an overview, broad brushstrokes of what we're working on, and I'm eager to learn more about what you all are doing. First, to provide a little context, the CF Foundation was founded in 1955. It was founded by parents who would not accept the dismal prognosis they heard from their clinicians. And they got together and decided that they were going to create a different future. This was the mission statement, and this is a typical black and white photo, a Leave It to Beaver family. And that sign says, "A major killer of our children." Fast forward to 2017, and this shows sort of an updated mission statement that I'll let you read through. And it shows you really the new face of cystic fibrosis. This young adult, Danny, is about 20 years of age. He's looking back at a picture of himself on the cover of Science. This is the edition that reported on the discovery of the CF gene. One of the log jams in Science in cystic fibrosis, there's just been a burst of scientific activity that has now led to transformational therapies that are now making their way into the clinic, and we think they're going to have a major, major impact on this disease. Back when the foundation was formed, you can see the median predicted survival was single digits and how it's increased over time. The latest data in 2016, the median predicted survival was 47 years of age. How did we get to this point? A lot of it relates back to high quality specialized CF care. And sort of the foundational elements included a care center network that was started in the early 60s, multidisciplinary care led by credentialed and experienced physicians, built out initially in children's hospitals, and then over the last 20 to 30 years in university hospitals to care for the growing number of adults. The Patient Registry, again, it dates back to the late 60s. This is the way we've tracked progress on the disease. We use it for multiple purposes, really one of the crown jewels of the foundation. And then clinical practice guidelines, where we bring multidisciplinary teams together to look at all the evidence and develop either consensus statements if there is no evidence or evidence-based guidelines. These provide a framework for CF care and help to standardize care. As Guy mentioned and Bing mentioned, over the last 15 years, we've focused heavily on introducing quality improvement. This is standard business process improvement, teaching our care teams how to standardize and improve care using a scientific method guided by the data, the registry data. The roadmap we developed with QI experts and CF experts, and it dates back to 2003. That roadmap we called an opportunity statement and included a vision of exemplary care at all of our care centers. And we developed 7 worthy goals. And the first worthy goal was that patients and families are full partners with the CF care team. Information and communications will be given in an open and trusting environment so that every patient, family will be able to be involved at the level they desire. Care will be respectful of individual patient preferences, needs, and values. At the time, this was really an aspirational goal. But in working towards that, we worked to bring the voice of the patient and family into our improvement work. And the improvement teams, we mandated that they included an adult or a parent on their team. In fact, one of the leaders of our program is a parent of a child with CF. Cathy Sapatos has been with us for 14 years. As you can see, she's not based here in Arizona. She's up at Dartmouth. They love the cold weather. And to her right is her son with cystic fibrosis, Jack. He's getting ready to go off to college. We've seen this young man grow up. More recently, we've brought in the voice of the patient and the family through an experience of care survey that we developed with our colleagues at Dartmouth and have deployed over the last few years. One of the questions asked about mental and emotional health. So after a clinic visit, we send a survey. They complete it online or by interactive voice recognition system. And this question, were you asked about your mental or emotional health? And you can see the scale, yes, definitely asked this question. And you can see the improvement that we've seen from 2015 through the summer of 2017. And we've really facilitated this by providing our care centers with some additional funding to hire part-time mental health coordinators to try to get at holistic care. Also, as part of this survey, there's an opportunity for patients or parents to put verbatim comments in about what they like about the care they're seeing at their care center or what could be improved. And I'll show you just a few examples of comments that were input. This is from a parent. Step back from the physician point of view. Remember, every decision you make impacts the parents, patients' schedules, and lives greatly. Adding medicines, feedings, includes figuring out ways to add these things to an already chaotic schedule. And it's worth asking us how we feel about those changes before implementing them. Be more understanding of the mental health side of CF and how much it impacts our lives. Here's a good quote. This is what we're aspiring to. They involve me, offering suggestions on what they think may help me be healthier. They ask what I feel is working and what isn't. They're willing to work with me to figure out what is best for me, to make me the healthiest I can be. So now, over the last few years, we've evolved from bringing the voice of the patient to our work to really recognizing that we're powered by the CF community. We're powered, and we need to get to this idea of co-production, or what we term partnerships. Instead of developing programs for people with CF, we're trying to get to developing programs with people with CF, co-designing. Instead of the question, what's the matter with you, that you may hear from the clinician, it's what matters to you. So some of this work we put in this term of the care model of the future. You've heard from Guy about the co-production dashboard. We're on that same path and working with some of the same leaders up at Dartmouth, Gene Nelson and colleagues, to follow on this same track that Guy talked about. We've also been working on a pilot learning network, and I'll talk a little bit about that, and an adherence initiative that we've reframed around partnerships. So this pilot learning network involves 30 CF programs across the US, and it's focused on improving outcomes. Patients and parents are full partners in this endeavor with the healthcare professionals. They're on the same technology platform, sharing ideas. We have community conferences twice a year. They participate by video conference or in person, and they're contributing, they're leading this initiative. We have Ignite talks at these conferences, and they're given by parents or adults with CF, and they tell their personal story and their challenges and how they've overcome those challenges. And these are very inspiring presentations. Here's some folks to the left. There are two adults there, young men with cystic fibrosis and a parent, mother of a child with CF. And then that other figure, who do you think has CF? It's not the children. It's Greg. He's an adult with CF, and he was in person at this meeting, gave a very inspiring testimonial on his story of cystic fibrosis. And this is a comment from a parent. This is Lisa working with the Seattle team. She said, "I deeply appreciate the recognition that it takes all of us, parents, patients, medical providers, and the Cystic Fibrosis Foundation to work together to defeat this disease. There is so much talent within the patient community, valuable skills and gifts that don't necessarily fit easily in the medical world. I'm so grateful to the CF Foundation for welcoming ideas and contributions from parents and patients." Now this reframing around adherence. This was a top-down initiative that came out of our strategic planning initiative in 2013. As part of that, we brought all the key stakeholders together, including adults with CF and parents of children with CF. And what we learned from them is they didn't like the word adherence, that there was a judgmental tone to that word and sort of a finger wagging that it was all on them. The doctor knew best, and they just had to follow through. So with their input, we've reframed this initiative, and it's a mouthful, but this is where we landed on partnerships for sustaining daily care. The regimen in cystic fibrosis is rigorous, 2 hours or more a day to do the treatments, the inhaled treatments, the pills, the exercise, the airway clearance. So it really is about sustaining, and it's every day, day after day, week after week, month after month. And it requires a partnership to get to the right treatment regimen. Marissa was one of the adults that participated in that initiative. And this captures the whole picture of her life, her daily life. And you probably can't read this in the back of the room, but all the oval blue circles are sort of medically related aspects of her day. But what you can see, there are a lot that aren't circled in blue. She has a life outside of the clinic, outside of the hospital. And in fact, this one down to the lower right is sort of her North Star. It's her nieces and nephews that she values and loves and wants to see them thrive and grow up. So how does this concept of partnerships fit into this chronic care model that was developed by Ed Wagner and colleagues over 20 years ago? Well, I think it fits in perfectly. You can see there that he talks about productive interactions between informed, activated patients and prepared, proactive practice teams. But I think it's more than productive interactions. It's about relationships. It's about partnerships. It's about mutual respect, effective communication, shared knowledge that contributes toward development of shared goals and a shared treatment plan. We call that partnerships. You can call it co-production. You can call it whatever, but it all means the same. It means working together. Hibbert and colleagues have developed this model that they call patient activation. And we know that not all patients, and by the way, not all clinicians, are ready to develop partnerships. Hibbert and colleagues talk about 4 levels. Level 1, disengaged and overwhelmed. And their perspective being, my doctor is in charge of my health care. Level 2, they term becoming aware but still struggling. Their perspective, I could be doing more. Level 3, taking action. Their perspective, I'm a part of my healthcare team. And then the highest level, level 4, maintaining behaviors and pushing further. The perspective being, I'm my own advocate. I understand there's some arthritis warriors in the room. How many of you are at that level 4? Raise your hand if you're at level 4. Okay, I see a fair number of hands in the audience. That's great. So let's come back to Marissa, this 40-year-old with advanced lung disease, and think about the impact that cystic fibrosis has on her life. And here to the left, it shows some of her adventures in the healthcare system. The inconvenience, the discomfort, the danger of her interactions within the healthcare system. Her disease symptoms, her treatment burden, and all the activities that she has to go through, the time, the mental energy. That's really well. On this side of this slide is where the healthcare providers focus, and sometimes narrowly focused even in that middle one. They don't even consider the treatment burden or the interactions with the larger healthcare system. Marissa also has a life outside of the clinic, outside of the hospital, and she faces these administrative burdens, financial demands, and limitations. How do we, as a foundation, help her meet those demands? This is a busy slide, and I'm going to focus your attention just on one part of this slide. These are results from a survey that we conducted of parents of children with CF and adults with CF about a year ago. And what we were seeking is what were their information needs and what were the preferred sources of those information needs. And you can see for advocacy, access, and insurance-related issues, they look to the foundation. And we've tried to take a leadership role in these areas. In advocacy, we bring people to DC for 2 major events, March on the Hill and Teen Advocacy Day. We bring in parents, we bring in siblings, we connect them with their representatives, and CF Foundation representatives go along with them if there's policy or medical questions. But the real power comes from the personal stories that they volunteer. And this to the left is an adult with CF and a parent of an adult child with CF talking to a member of their congressperson's office, the Democrat Nadia Velasquez. We also have Compass, which is focused on helping patients and families navigate insurance, financial, legal, and other issues. There are other burdens on Marissa around social interactions. In cystic fibrosis, for infection control reasons, people can't gather, so they can't share their personal stories face to face. And of course, the existential issues of having a life-shortening disease. and facing premature death. Again, back to that survey, what we find is that people with CF seek a lot of this information from their peers. Even some of what I might consider medical issues, like exercise programs, they seek some of this from their care team, but also from peers. And then if you look down towards the bottom, day-to-day life with CF, life transitions, CF and relationships, they seek this information from their peers. And so we've worked on connecting, facilitating these connections through a peer mentoring program currently focused just for adults. And it's the idea of easing the challenges that people with CF face as they go through normal transitions of adult life. These are some of the commonly discussed topics. We pair these folks up one-to-one, we train the mentors, and we keep them from getting into the medical issues, but really on life issues. We also connect the community by way of virtual events. In these, we provide the facilitation and support, but these events are led by individuals with CF or parents of children with CF. And there are keynote speakers, panel discussions with Q&A, chat rooms, photo sharing, artistic outlets for creativity and social connections, and then breakout sessions facilitated by people with CF. We have what we call a BreatheCon. We just had our second BreatheCon. These are two-day events, again, led, facilitated by primarily adults with CF. And then shorter topic-specific events that we call mini-cons, and we just had one on lung transplantation. This individual who participated in BreatheCon said, "I will be thinking before BreatheCon and after BreatheCon as a moment in my life that helped me to better manage my disease and my mindset." So we've arrived at this idea of achieving the mission. It's not led by the CF Foundation, it's really us as facilitators, networkers, and it's really powered by the CF community. All of us together, researchers, clinicians, individuals with arthritis or CF, coming together to move forward in partnerships or co-production. So I'll leave you with a closing thought. Think back to that activation scale with the 4 levels, the lowest level being my doctor is in charge, and the highest level, level 4, I am my own advocate. Imagine connecting people that are at that level 4 and gaining alignment with their healthcare providers. Imagine what could be accomplished in improving the system of care, in advancing advocacy, in furthering research for CF or for arthritis. Organizations like the CF Foundation and the Arthritis Foundation have an opportunity and perhaps a responsibility to play an important role in turning this imagination into reality. So thank you for your attention.
So, Bruce, thank you very much for showing us the inspiring work and progress the Cystic Fibrosis Foundation has made. Your words give us courage to move ahead on our co-management project and provide ideas for future Arthritis Foundation initiatives relating to patient engagement. So now we'd like to end the formal part of the program. There will be time for questions and answers after the final presentation. I'd like to introduce our Director of Patient Engagement, Suz Schrandt. Now, Suz is a new hire. She was previously in charge of patient engagement at the Patient-Centered Research Institute, and PCORI for short, for those of you who know the acronym. And we're really very fortunate for her to come on at this stage of our evolution as a volunteer lay organization that's really interested in further engaging our patients in all that we do. She's going to talk about our work in patient engagement, including our goals to offer more patients the opportunity to participate in research and share their perspectives. Sue?
Well, good afternoon, and it's really a pleasure to be here and a privilege to be here. And thank you, Bing, for the introduction. I actually have been connected to the Arthritis Foundation for a very long time because I grew up with JA, and so my first touch with the Arthritis Foundation community was at a JA conference as a teenager. So it's really just wonderful to be connected to my community again. So you've heard now from both Bruce and Guy about the pivotal role that patients can play. And I think one of the central themes you've heard throughout the day today is that value, that power of the patient voice. And we're really putting the patient voice central in all that we do. I'm going to talk a little bit about patient engagement in sort of two fronts. You've heard about this role of patients engaging in their own care through our very exciting co-production work that Guy has referenced, and certainly couldn't be more excited to see where that goes. We know that as patients, that's such an important role for us to take, to be, moving from passengers to co-pilots. We want to be active and involved and engaged in our own care, and that's so important. But the new type of patient engagement is sort of the other side of that coin. So the historic use of patient engagement has been active patient engagement in our own care. Now we're looking at patient engagement in the system that serves us. So being a patient partner on a research project, or being a patient partner working with industry partners, or working directly with the FDA to tell them what we need and why we want better treatments and why we need them more quickly. So it's that shift that we're actually looking now at, moving out of our own care, still so important to be partners in our own care, but maybe moving to the next level and looking at shaping the system and improving the system that serves us. But how does that work? A lot of us have never done that type of work before. What does that look like? Patients can have roles in any part of the research process, whether it's planning. So you might imagine if you're a patient partner and you're in a room with a research team, maybe your first job is to think about what are barriers to clinical trials that patients face? What if we could make it easier? What if I don't have to drive across town to do a blood draw early in the morning? What if a visiting nurse came to my house and did it there? Or what if I got to do a trial using my own doctor? I didn't have to go somewhere else to be involved in a trial. What if the study materials were in words and language I could understand? That's the kind of contribution patients can make right up front, helping to plan. But patients can also be involved in the conduct of the study. So the actual data gathering or helping recruit people to be study subjects. Wouldn't you trust a clinical trial more if someone you knew who had your disease was actually partnering on that study team? I'd automatically feel better and want to know more. If any of you have read those informed consent forms that are 15 or 20 or 30 pages long and it's full of legalese and you can't understand what it says, what if patient partners helped revise those and make them into, English words that humans use so that we could understand what we're actually getting ourselves into? That would be amazing. That's what's happening in patient engagement and research. And then certainly sharing results. So moving from just putting study results in a medical journal that sits on a shelf, actually making those results usable and understandable so that we can share it patient to patient, community to community, so that I have information that I can actually make treatment decisions with. Who would have thought? What a good idea, and that's what patients are doing. And sometimes it's just as simple as getting patients in the room to talk about what are the challenges that you face, and where do we really need to tackle, where do we need to focus our research, where do we want to put those efforts. I have a great example from just this past summer, attending a JA conference. It was like having a reunion, going back to where my relationship with the foundation started all those long years ago. So I'm talking to a group of young adults, and we were actually kind of celebrating the advent of auto-injectors, because that's the kind of thing you talk about at an arthritis conference. And I remembered the days when we had tiny little needles and my big swollen hands would hurt and it was difficult to do. And so we all thought, so great, we've got these big cushy auto-injectors. It's just a little like this with your thumb. Great idea, great solution. And then one by one, each person started to say, but you know what? That's 50% of the shot. You know, that's what I do with my right hand. My left hand, which is also swollen and achy, has to do the pinch because it's a subcutaneous injection. So I've got to use that same hand that doesn't work and try to pinch myself to get the shot. And I miss, and I hit my muscle, and I get a welt, and it's really unpleasant. And so I kind of took this nugget to a conference I was attending with a whole bunch of engineers, and their minds were blown. And I had a long line of people waiting to talk about this, and they were devastated. I said, how could we miss this? You know, we worked so hard on the auto-injector, how could we miss the pinch? And I said, because your hands are healthy. Why would it occur to you that it's hard to do the pinch? That is the power of patient engagement. You gotta get patients in the room because we can tell you what we need and we can help you get there. So that was a really fun nugget to be able to share. You know, one of the really great projects we were able to do just this year was with the FDA. You've heard this referenced before. This was our osteoarthritis patient-focused drug development meeting. We had a whole host of patients there in the room with the FDA telling them what this disease is really like and what we need in our treatments. And a lot of patient advocacy organizations have done these called PFDD meetings. But we took the model and kind of blew it up because we have such an amazing and large community. Not only did we bring our 10 patient representatives to physically be in the room, and then we had audience members with arthritis too. We did focus groups all around the country. We did surveys. We live streamed our meeting with the FDA so that we could have a whole body of data and then really punctuate it with the live patients in the room. And I don't mind telling you that the FDA said this was one of the best ones they'd ever seen. We were pretty excited about that. These are some photos of the patients that were able to be there and share their stories. And here are some of the themes that we heard. And you know, a couple of these jump out right away. You see, what is the evidence? What's the long-term prognosis of the new therapy? That sounds a lot like co-production to me. That sounds like patients saying, I want to be active in my care decisions, I want to know more. So we heard that theme come out. Patients want to be active partners in their care. But then that clinical trials quote really speaks to me. Clinical trials should look at quality of life and sleep and fatigue. Here again, we see a perfect example of why you want patient partners helping design clinical trials. Often the end point, the thing that's being measured in a research study, is like a blood marker or maybe an x-ray. And all of us know that sometimes my blood markers don't show what I'm really feeling. Sometimes I feel pretty lousy if my blood markers don't show it. Those patient-reported outcomes, those types of measures, are what patient partners would add into a clinical trial protocol. They'd say, let's make sure we're asking people about being fatigued or asking them about their pain. So a lot of just amazing themes came out, and actually Janet Maynard of the FDA was really moved, and you can see here she talked about how profound it was hearing that this was an invisible disease described as a silent enemy, and she was really stricken by the depth of the information provided. This is just a quick snapshot of what's happened so far. So we're involving patient partners really across our entire scientific research policy strategy. You name it, we want patient partners involved. You can see on our Medical Scientific Affairs Committee, we've got representation. We had patients helping select awards for funding. We have several research projects listed here that all are including patient partners. what I really want you to take away from this slide is both excitement, because we want you to get involved, but also pride, because we're really at the front edge of the patient engagement movement. There are not very many patient advocacy organizations doing this type of work, and we are really pushing it forward, and we'll continue to do so with all of you. But how do you do it? How do you get involved? Well, the first step is to raise your hand and say you want to get involved. I think that's the most important first step. We need more and more of you. We want a diversity of representation in these efforts, and so that's step one. The second part is really about training, and that's what we'd provide. So we're working on an enormous training platform. A little bit of it is content. So if you were, for example, going to be a partner on a research study, you might need to know some terminology, know a little bit about research. But the second part of the training is really about skill building and learning how to flex those patient engagement muscles so that you can take all that universe of experience that you've had and sort of translate it into action for research, working with industry partners, working with the FDA, whatever it may be. And we're developing a program called PrEP, Preparing for Roles as Expert Patients, and that will be up soon. You'll be able to access that. And then lastly, evaluation and process improvement. After we've placed patients in these roles as partners, we want to hear from them. How did it go? What do we need to adjust and revise so that it can be better and better? And we're also documenting the impact that our patient partners have. How did the research get improved? How did we speed the development of new drugs and devices? How did we improve things based on that patient engagement? And so, again, it goes back to that first step, which is just raising your hand and saying, I want to be a part of this. And I've got my email up there. You can certainly reach out to me. You can reach out to your local market. And once we get that PrEP training live and on our website, that'll be another great place to go engage. So I know we'll sit for Q&A now, but I just want to say thank you so much. I really, again, feel honored and privileged to be part of this community. So thank you for your drive and your commitment and your passion.
So thank you very much, Suz. So I've been told by management we don't have time for Q&A, but I'm going to allow us 5 minutes of Q&A, all right? The reason that they need the room is because they need to redo this for the evening event. But 5 minutes of Q&A, so let me open it up to anybody that has a question. Do we have mics in the room that can be helpful? Anybody wants to talk about any particular item? Let's see. We have somebody? Yes, please.
I have heard of the CF model of patient engagement and the research engagement in other settings, and I'm very, very impressed. Thank you for joining us and sharing with us. My question is more the implementation. You were talking about over a period of time, but I didn't hear anybody talk about money and how much that process had cost you. Can you give us some tips on the investment just to get that up and going? What partnerships were needed to really drive it, to give us an idea of really behind the scenes what kind of a foundational support we need to do?
That's a great question, but I don't have a great answer for it. It's I think a lot of it doesn't take a lot of funding. It's about the things that Suz talked about. It's about the training and connecting people. I mean, when we think about what we've done in quality improvement in general, we've invested very heavily there. But a lot of that is money going into the care centers to be able to get the teams to break away from their clinical duties to actually learn process improvement and do the work. So I think the patient engagement piece, now we've formed a new department called Community Partnerships, and we are starting to put some funding in there. I don't know the dollar amounts, but hiring some staff to focus on that and to do the virtual events and those sorts of things, and developing the mentoring program further to serve families. So we are starting to invest significant dollars there, but what we've done on the quality improvement front really wasn't a substantive investment.
Yeah, just a little, maybe my take on this. You know, Suz is a really very talented lady, but you know, we're going to need more of her. We're going to need to clone her many more times for us to really kind of get to where we want to go.